ovulation symptoms. In this video today, we are going to learn about ovulation symptoms. By the end of this video, you will know all the symptoms of ovulation and everything about ovulation. Keep watching after this message. Thanks a lot, my friend, for staying around. We are talking about ovulation symptoms in this video, and today we are talking everything about ovulation. If you have any questions in regards to the symptoms of ovulation, just send the questions. I will answer all your questions personally. And without further ado, we shall remind ourselves that ovulation is the release of an egg when it actually is mature. This normally happens on the 14th day. This egg is always fertilized in the ampulla. The ampulla is a part of the fallopian tube where fertilization takes place. This egg, after being fertilized, it goes on dividing from one egg. It divides into two, and then it goes on dividing. The cell division continues taking place as the egg is moving along the length of the fallopian tubes. So you realize that when this egg that has been fertilized reaches the fallopian, it reaches the endometrial lining or your uterine lining, it actually attaches itself onto the uterine wall, or it implants. And then after implantation has taken place, then growth can take place, whereby the egg becomes the embryo, and then the embryo becomes the baby, and then the embryo becomes the fetus, and then the growth continues taking place until 9 months when the baby is ready to be born. So we are talking about the ovulation symptoms, and without further ado, we shall go to the first symptoms of ovulation, and these include, there's going to be cervical mucus changes. When a woman is ovulating, there are two hormones that are involved in this. The first hormone is the luteinizing hormone, and then the next hormone is the estrogen hormone. So these two hormones, when they have increased in their quantity, in their amount, normally there's going to be release of cervical mucus. This cervical mucus continues throughout the whole period of ovulation, which normally lasts for 12 to 24 hours. Next sign of ovulation is there's going to be a heightened sense of smell. The heightened sense of smell is also due to the hormones that have increased in their amount. A rise of hormones, specifically estrogen and also progesterone, the pregnancy hormone, when they do increase in their amount, normally there's going to be, this is going to be one of the signs of ovulation. Next is there's going to be breast soreness or tenderness. Simply here we are talking about the breasts, or your breasts becoming slightly painful and also kind of a bit increased in their size. But normally when they are sore, or if at all your breasts become painful during the 14th day, then you could be actually ovulating. Next is there's going to be mild pelvic or lower abdominal pain. This pain is normally one-sided. It could be on the left side, it could be on the right side. On whichever side you feel the pain, that is the side that the egg is being released from. So you actually should not worry about that. Normally it actually stops after ovulation has taken place, or after fertilization has taken place. Next is there's going to be light spotting or a discharge. Light spotting or a discharge showing, it is one of the signs to confirm that you have got pregnant. It's also known as implantation bleeding. So but when you are in your ovulation and then you see some light spotting, still this could be due to the egg. That has been released. So some little blood may actually show, but still this is actually hormonal. It does not last. It can actually stop. Next is there's going to be libido changes. Libido changes normally are due to also the hormones increasing, and normally this also tends to come down. So when your libido increases, more specifically around your 14th day or in the middle of your cycle, that is the time when you are most likely ovulating. You basically need to confirm this by getting some ovulation predictor kits, and then these ovulation predictor kits can show that yes, you are ovulating. Next is there's going to be changes in your cervical canal or in your cervix. So these changes normally are basically due to ovulation taking place, and you actually can feel as if your cervix has moved downwards. Still, these are changes due to ovulation, and without further ado, ovulation still, if at all we are to take an example of this calendar, if you ovulated, if you saw your periods on 4th, your date of ovulation is normally 14 days from the first day you saw your periods. Let me know if you have any questions. Subscribe for new videos we release every day. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.